Welcome to my presentation on KETOFEN. This presentation will cover the pharmacokinetics and pharmacodynamics of KETOFEN along with clinical considerations. It will also address healthcare providers' responsibilities in educating and managing patients prescribed with this medication. KETOFEN belongs to the propionic derivative class non-selective non-steroidal anti-inflammatory drugs or NSAIDs. This drug has analgesic, antipyretic, and anti-inflammatory properties. KETOFEN is used to treat mild to moderate pain and inflammatory joint conditions such as rheumatoid arthritis and osteoarthritis. Pharmacokinetics. KETOFEN is absorbed orally from the gastrointestinal tract, with peak plasma levels occurring within 0.5 to 2 hours. After oral administration of 100 mg of KETOFEN achieves its maximum plasma concentration of 6 to 14.3 mg per liter Cmax within 0.5 to 2.5 hours Tmax. KETOFEN is distributed in body tissues with a volume ranging from 0.1 to 0.2 liters per kilogram. It is 99% protein bound. KETOFEN's metabolism involves oxidation and conjugation processes in the liver. The main enzymes responsible for these reactions are cytochrome P450 with cytochrome P2C9 and cytochrome P3A4. These enzymes convert KETOFEN into various hydroxylated metabolites. Following oxidation, the metabolites undergo glucuronidation, facilitating their excretion from the body. Around 90% of the administered dose is excreted through the kidneys and eliminated in the urine, and the rest is in the feces. It has an elimination half-life of 2 to 4 hours in young adults and middle-aged subjects, though this can vary based on individual factors such as age and renal function. Going on to the pharmacodynamics, the anti-inflammatory effects of KETOFEN are attributed to its inhibition of cyclooxygenase 2 or COX-2. An enzyme that plays in the synthesis of prostaglandins by the arachidonic acid pathway. By blocking COX-2, KETOFEN reduces the production of prostaglandins, which are mediators of inflammation, pain, and fever. KETOFEN also inhibits COX-1, which produces prostaglandins that protect the gastric mucosa, support renal blood flow, and promote platelet function. This non-specific inhibition can lead to gastrointestinal side effects. KETOFEN also has anti-bradykinin activity, a peptide that contributes to pain and inflammation and stabilizes lysosomal membrane, which helps prevent the release of proteolytic enzymes that contribute to tissue damage and inflammation. An antipyretic effect is due to action on the hypothalamus, resulting in an increase in peripheral blood flow, vasodilation, and heat dissipation. KETOFEN is classified as a Schedule IV medication under the poison standard. This indicates that it is available only by prescription. Patients need to obtain a valid Australian prescription from a medical, dental, or nurse practitioner. It is the prescriber's duty to conduct a thorough assessment of the patients and communicate the benefits and risks associated with KETOFEN, ensuring the patient understands how to use the medication. The pharmacist's role is to provide education about KETOFEN's potential side effects, drug interactions, and drug adherence. Adherence to prescribed dosage, timing, and adequate hydration are essential for patients taking KETOFEN. For women trying to conceive or those who are pregnant, the use of NSAIDs is generally not recommended as they may impact fertility and increase the risk of miscarriage. Caution is also given in the use of anticoagulants, other NSAIDs, and some antidepressants. Side effects such as gastrointestinal discomfort and headaches should be reported if persistent to a healthcare provider. Liver damage, gastrointestinal bleeding, which includes black stool and coffee ground vomit, severe allergic reaction, shortness of breath, and swollen limbs and chest pain are serious reactions from KETOFEN.